Hello, all, and welcome to 2021. I hope you've had a good start to the year. We're only on the 4th of January, so I guess there's time yet for things to develop and become more interesting. But here we are into a new year after everything that 2020 threw at us. I hope that you all have a good year ahead, and of course, we here at the FMF will be fighting the good fight as best as we can with your support, and we look forward to doing that. For today's episode, I just wanted to do a quick sort of news flash update regarding South Africa's COVID-19 vaccine plans. For those of you who didn't watch yesterday, Health Minister Zweli Mkhize addressed the nation regarding the government's vaccine rollout plans, and I thought I would just do a quick overview, very short, and just give some of my thoughts on the whole story. So to start off with, the South Africa is expected to start receiving the vaccine to cover 10% of the population through the COVAX initiative by the beginning of the second quarter of this year. Mkhize said that government departments were working urgently to secure vaccines through bilateral deals with manufacturers. He said the target date was really, quote, more of a wish, and no deals had been reached to deliver vaccines by February, but the government was fighting to secure supplies before the second quarter of the year. Under the strategy, a vaccine will be administered in 3 phases, starting with the country's estimated 1.25 million frontline healthcare workers. An estimated 16 million people will be vaccinated in the second phase, including people working in essential services and congregate settings, the elderly, and people with comorbidities. Phase 3 will target another 22 million people to bring the total number of persons vaccinated to 40.3 million, or 67% of the country's population, the level at which it's believed herd immunity can be achieved. So we're back to herd immunity again. It seems we've jumped around whether we believe in that or not, or whether we should or not. And Health Department Director General Dr. Anban Pillay said he was fairly confident South Africa would receive vaccines in the first quarter of 2021. Now, the briefing yesterday by the government comes in the context of criticism on the part of civil society and healthcare professionals regarding the government's vaccine plans. Leading health professionals, including SA Medical Research Council President Professor Glenda Gray, I'm sure many of you will remember her from last year. She was part of the Ministerial Advisory Committee, or the MAC, and Progressive Health Forum convener Dr. Aslam Dasu recently said the state's, quote, lack of foresight will visit on us the consequences of the greatest man-made failure to protect the population since the AIDS pandemic, end quote. That's quite damning, I think. They also claimed that state health officials had embarked on a, quote, frantic cover-up and evasion of culpability, end quote, by recently downplaying the importance of securing a vaccine. So I guess that's par for the course when it comes to the South African government. We shouldn't be surprised that it is behind the curve in terms of securing a vaccine. That shouldn't come as a surprise given everything else the government has managed to mess up over the years. We, of course, the FMF, we believe the more government is involved in managing people's lives, the more opportunities there are to mess up, the more opportunities there are for corruption, malfeasance, inefficiency, that kind of thing. The more you place on the state to do, the bigger the opportunity for the state to mess up, especially when the necessary skills and finances aren't there. Just to give you a bit more details, officials of the government also said they could not elaborate on negotiations due to non-disclosure agreements, but said they expected Pfizer, AstraZeneca, and Johnson & Johnson would submit application to the SA Health Products Regulatory Authority for approval by the end of January. They said Moderna, which was the second vaccine to receive emergency approval in the US after Pfizer, was not expected to apply for approval from SAHPRA. Now, just to give you more details in terms of the rollout and its effects on medical schemes, if, for example, you're part of a medical scheme, the government also made clear it will procure all COVID-19 vaccines itself for distribution, and that private sector organizations or medical schemes will not be permitted to procure independently for their own members. Medical aid scheme members and the private sector will cross-subsidize the public sector. So again, we're calling on the evil private sector to come and help us. SA's only definitive promise of a vaccine is through the COVAX initiative, a global pooled procurement initiative to assist poor countries. So I think that's mostly what I wanted to cover. Maybe a final point as well. Despite the magnitude of the project, the government has said procurement will be centralized. A system in which medical aid scheme members and the private health sector will subsidize the state is under discussion, which would possibly see scheme members subsidizing the wider public on a one-to-one basis. So, we're behind the curve on this whole thing, getting the vaccine. And then we still have people both in government and civil society who think the government can manage a national health insurance, NHI. The NHI is probably the biggest plan alongside expropriation without compensation in terms of what the government aims to do in the next few years to increase its power over people's lives. Of course, all done under the guise of it is to the benefit, quote unquote, of the people. But we all know that that is simply a sort of facade that is used to further increase its control. The NHI will involve the monopolization of the management of all healthcare services in South Africa, and therefore around 50 million people's healthcare needs will have to be managed by the state. Now, I guess the proof is in the pudding, as it were. We've seen over the years how the South African state simply can't manage a lot of things, and to now think that it could implement an NHI and run it effectively, to me, is very fanciful, to put it mildly. I don't see any way in which it's going to be run well. And I just wanted to close off by a broad, I guess, picture for those of you who maybe forgot about it, or who need some more details regarding this whole situation. So, coming into COVID-19, the pandemic, the country's finances were already in a perilous state. We're approaching 100% debt to GDP ratio, and we're in a very difficult financial position because of the destructive policies of the government in previous years. So just two examples, or I can give you three examples actually: South African Airways, Eskom, and the Land Bank. Just recently, the Land Bank's operational performance continued to deteriorate as its financial losses grew by 211% to 2.8 billion rand for the year to 31 March 2020, compared with a loss of 902 million rand in the previous year. So the Land Bank, the government repeatedly says land reform is a big priority for it, but it continues mismanaging things such as the Land Bank, and then we are told that something like expropriation without compensation will actually solve the land dispossession problems of the past, whereas it obviously won't. We advocate for restitution, and we think it should be done properly under the rule of law, but we can get into that another time. Just another example then, Eskom, of course, it currently owes some 488 billion rand, largely guaranteed by the state, which threatens the fiscus. It's a big reason why the financial credit rating agencies last year kept downgrading South Africa. They do not have confidence that the state can finance its debt, and on top of that, if South African banks have given the state guarantees on these debts to these loans to Eskom and SAA, if there is a run on the debt, it will obviously affect the status of South Africa's banks, which has a further negative effect. So I guess the cycle will just keep on repeating itself. In 2020, support of 49 billion rand was extended to Eskom, with 56 billion committed for 2021, and the funds are largely for debt servicing. And the longer we have Eskom, the worse its burden on the state becomes. It really is way past time to split it up, to privatize it, to let people who can supply their own electricity and buy it do so. The state can supply electricity to those people who really can't afford it, and then simply downsize Eskom to a manageable state. But at this point, it's I think, quite untenable. And then the final example of why we're in this very difficult position, at least regarding state-owned enterprises and the fiscal situation, why we can't spend money to be first in the queue for a COVID-19 vaccine, is South African Airways. The latest news regarding that is the business rescue plan. For that, it needed at least 10.1 billion, which the state will give it. That is needed for paying more than 3,000 voluntary severance packages to employees. And it's also set to receive an additional 6.5 billion rand from the government that will go towards settling the airline's guaranteed debt and interest. Why South Africa needs a state-owned airline boggles the mind. We've got many airlines that couldn't compete, even throughout last year and this year, early this year. other airlines have managed to survive the pandemic and the lockdowns, and there's a lot of scope for travel to South Africa. We're, of course, famous for our tourism, so we need a lot of airlines, competition, lowering prices, competitive packages, that kind of thing. So there's no reason to think why other airlines can't fill the void. If SAA were to be closed down, I guess it just indicates that the vanity and the pride on the part of the South African government to keep SAA quote unquote flying, even though it's obviously not flying very well, that just indicates to you the state's priorities. Whereas it could be using that money, for example, for investing in and upgrading services in poorer communities, building houses, giving title deeds, that kind of thing, really empowering South Africans. That's real radical economic transformation and empowerment. The money that the state has is being used to finance projects, vanity projects such as South African Airways. So I think that sort of paints a picture for why we are in the situation, why the vaccine rollout program, at least the procurement part thereof, is in such a perilous state, why it's in such a bad situation, and why medical professionals and civil society organizations are criticizing the government for its vaccine plans, why it's taking so long to announce its plans, and why it's taking so long to negotiate with these companies and bodies overseas. If the finances of the country had been managed well, prudently, if resources had been spent on those things that were absolutely necessary, we would be in a much better financial position, and we would be able to procure a vaccine much sooner than is now the case. So I hope you found that of interest. Please remember to like the video. Please share it on your different social media platforms. We greatly appreciate the support. I hope you found it interesting. And I'll hope to do a few more of these sort of flash update videos in the coming weeks and months. But for now, I hope you have a good start to your January. And we'll talk to you guys again very soon. Bye-bye.